Pankaj Sahni, Group CEO of Global Health, is joining us to talk more about the numbers. Thanks very much for joining us. Congratulations. Good set of numbers this time round. The fourth quarter occupancy stood at 58% overall. The occupancy was actually slightly on the lower side versus the others in the industry, your peers. Talk to us about whether the occupancy is likely to improve from here on.
When you look at Medanta Group, it's important to understand that we are currently at about 2,700 beds across the ecosystem, but we continue to add in beds on a almost monthly or quarterly basis as we scale up our facilities in Lucknow and Patna. Our inpatient volumes for the year have grown about 32%. Our outpatient volumes for the year have grown about 15%. So when you look at our bed additions, you will see that almost 300 beds have been added this year itself. And we continue to do that build up as we speak. More beds, more operating rooms, etc. are getting added. We're very happy with the growth that we've seen, both in terms of volumes as well as in terms of our financial metrics on revenue and profitability. And we do see these continuing as we move into the future. When it comes to our occupancies, we find that as we keep adding the beds, of course, you will see some amount of volatility on the occupancy because we keep changing the denominator. But when you look at the absolute amount of bed days, when you actually look at the absolute amount of inpatient volumes or the outpatient volumes that were grown, we see this continue to rise. And we see this growth coming in international patients as well.
Okay, so good growth seeing in international patients as well. But, over the years, the contribution from your flagship, facility, which is Gurgaon, has been coming down. Going forward, what do you expect is going to be the mix between, let's say, Gurgaon and the new facilities that are coming up on board?
Well, obviously, Gurgaon, being our first hospital, being our flagship, and indeed our largest hospital, continues to remain an important part of the portfolio of hospitals that we have across the Medanta ecosystem. And we do see that it continuing to remain important over the next several years. A lot of the core practices, protocols, SOPs, clinical systems that we derive are actually derived in Gurgaon and then spread across the network. But increasingly, we have seen that now we have moved from a Gurgaon-centric hospital with maybe a couple of others added on in the periphery to a complete network where our Lucknow facility, which will be 950 beds by the time it's done, already at 600 plus beds. Our Patna facility at 650 beds, already at 330 beds, will continue to increase in terms of their overall share and will continue to grow. Not only that, but our Noida facility, which will come on board, and we've added on a new facility in Indore, which we intend to start construction on along with our partners. So over the years, you will see growth moving away in a very quick manner with the growth that we've seen in Lucknow and Patna. And we do believe that this will continue to happen as we move forward. As we move forward, you will see Lucknow, Patna, Noida, and potentially other facilities that we may have in the pipeline contributing a significant share to the overall growth of the company.
Your developing hospital revenue share has increased from 21% in fourth quarter to almost 28%. And EBITDA share has increased from 14 to 33 on a yearly basis. How do you see these numbers growing from here on, and what levels would that be?
Well, let me give you a little perspective. If you look at our Lucknow facility today, we have about 601 beds. We've added in their operating theaters this year. When you look at the 601 beds, approximately 200 beds are critical care beds. That hospital, by the time it is done, will be upwards of 950 beds. So almost another 30-40% expansion needed to happen in Lucknow. And if it continues to deliver on the same way, then you can do the maths and see that that, of course, will continue to grow. And also that growth will come at a significantly lower cost to serve, both in terms of the capex cost as well as in terms of the operating cost, because you will get the benefits of scale. A lot of the infrastructure that will be built out there will be built out at a significantly lower capex because we built out the complete shell of the building. Same is the story in Patna. In fact, Patna will grow even more. We're at about 330 beds today. That will be 650. So you will see Patna almost double in size over the course of the next years. And once again, that doubling will be benefited from the economies of scale, both on CapEx and OpEx. So you will definitely see margin improvements, you will see revenue improvements, you will see the share of the newer hospitals increase in the pie. But we do believe also that our flagship of Gurgaon continues to perform well. If you look at the growth that we've seen in our Gurgaon facility, if you look at the clinical additions, we've had almost 80 doctors added in just into the Gurgaon facility itself. So we continue to focus in on delivering growth, looking at newer avenues, looking at adding more super specialties, looking at more complex work across the ecosystem.
Sure, and before we let you go, growth in the pharmacy business has been strong. Outlook for that business?
When you look at our business that is delivered outside of our hospital or our core hospital business, that's the outpatient pharmacy clinics, the lab services, as well as our home care, our original thought has always been to ensure that we are able to provide our patients with these services as they move out of the care of the hospital. So deliver the entire care across the continuum, making sure that we're able to deliver this care closer to home. The pharmacy business has performed exceedingly well, generating about 80 crores of top line in this financial year, and we continue to see that grow. However, our approach has always been to be very deliberate to make sure that we are doing these in terms of measured, stable steps, rather than trying to chase out numbers or just trying to populate pharmacy or lab collection centers across the country. So we believe that these are ancillary services to the core hospital business. We intend to continue to grow them, but to grow them in a stable and deliberate manner, linking them very much to the core of patient care that we deliver and linking them to the continuity of care and focusing really on the geographies where our primary hospitals exist.
All right, Mr. Sahni, thank you very much for joining us today with a lowdown of your numbers.